Are you confused on the different parts of Medicare and all the letters? In this video, I'm going to break down and explain each part of Medicare to make it easy to understand. Hey guys, Alex Wender here, founder of Blue Wave Insurance Services, where we help folks across the country with their Medicare and retirement needs. So Medicare is made up of Medicare Part A and Medicare Part B. Medicare Part A is also known as hospital insurance and will cover you for inpatient hospital stays, care in a nursing facility, hospice care, some home health care, and among other things. If you or your spouse have worked and paid taxes for at least 10 years or 40 working quarters, typically won't pay a premium for Part A. Now, you won't pay a premium for A, but there are some out-of-pocket costs associated with using your Medicare Part A. Some of those costs will be a deductible of $1,632 for each benefit period in 2024. This means you pay that first $1,632 of your hospital bill out of pocket. Now, after the deductible, you'll have a co-insurance on Part A. The first 60 days of inpatient care on Part A, you pay $0. From days 61 to 90, you'll pay $408 per day. For days 91 to 150, you'll pay $816 per lifetime reserve day. You have 60 of these reserved lifetime days. After these are used up, you'll pay all costs. So let's talk about when to enroll in Part A. You can enroll in Part A during your Initial Enrollment Period, also known as IEP, which starts 3 months before you turn 65, includes the month you turn 65, and ends 3 months after. If you delayed Medicare Part A due to employment, then you can simply sign up for Part A when you sign up for Part B, which I'll cover next. Now, next we're going to cover Medicare Part B. Medicare Part B, which among other things covers outpatient care, doctor visits, preventative care, and durable medical equipment. Part B has a standard monthly premium of $174.70 in 2024. However, this amount can be higher depending on your income, which is also known as IRMAA, or Income-Related Monthly Adjustment. If your modified gross adjusted income, as reported on your IRS taxes looking back 2 years, is above a certain amount, you'll pay an IRMAA in addition to the standard Part B premium. I'll link below in the description to the IRMAA chart so you can see it. So enrollment on Part B, your initial enrollment period is the same as Part A, which is 3 months before, the month of, and 3 months after your 65th birthday. If you or your spouse is still working and you are covered by an employer plan, you can delay Part B without a penalty. Once you or your spouse retires, you'll have an 8-month Special Enrollment Period, or SEP, to sign up for Part B without facing a late enrollment penalty. The penalty is a 10% increase in your monthly premium for each 12-month period you could have had Part B but didn't sign up. So be sure to sign up on time. Now, some common questions around A and B. How do I know if I have Part A and B? You can check your Medicare card and it will show if you have an active Part A and or B on the Medicare card. It'll say Part A, Part B, and then it'll have the effective date next to it. You can also log into your SSA.gov account, or you can simply call 1-800-MEDICARE. What to do if you missed your initial enrollment period? If you missed your initial enrollment period for Part B and you didn't have credible employer coverage, you can sign up during the general election period, also known as the GEP, from January 1st to March 31st of each year. The coverage would start the first of the following month that you signed up. But beware, you may face late enrollment penalties with Part B. If you are entitled to premium-free Part A, you can sign up whenever you want and there won't be any late fees. If you do not have enough working credits, you have to pay a Part A premium, and if you didn't sign up on time, you will have penalties for the Part A if it's not free. Medicare Part C, also known as Medicare Advantage. Medicare Part C is an alternative to original Medicare. These plans are offered by private insurance companies and combine Medicare's A and B together and become primary to your Medicare. Many of these plans also include prescription drug coverage, referred to as Part D, and extra benefits like dental, vision, and fitness. These plans have networks of doctors and come in the form of an HMO or a PPO. They're typically viewed as pay-as-you-go, as these plans have co-payments and out-of-pocket costs associated with the plan. Premiums are generally $0 per month for these plans. You can enroll into a Medicare Advantage plan during your initial enrollment period. The same as for Parts A and B. If you missed this, you can also sign up during the Annual Enrollment Period, referred to as AEP, that runs each year from October 15th to December 7th, with coverage starting January 1st. There's also a Medicare Advantage Open Enrollment Period, which runs from January 1st to March 31st each year, where you can change from one Medicare Advantage plan to another, or go back to original Medicare and drop your Advantage plan. If you delayed Medicare due to employment, you will have a special election period to sign up for a Medicare Advantage plan that only lasts for 63 days, starting the date that your employer coverage ends. Now let's talk about Medicare Part D, which covers your prescriptions at the pharmacy. These plans are also offered by private insurance companies, and you can get your Part D either as a standalone plan with original Medicare, or if you go with an Advantage plan, it's generally included in the Advantage plan. The enrollment for Medicare Part D is the same as A and B when you turn 65, that 7-month window. If you're coming off employer, you will only have 63 days to get a Part D plan without a penalty. This is referred to as your Special Enrollment Period. If you don't enroll into a Part D on time, you can have a penalty for life that's based on the amount of months you went without the Part D plan. Now, most people who go with original Medicare also purchase a Medicare Supplement plan. These plans help cover some of the out-of-pocket costs not covered by original Medicare, such as co-payments, co-insurance, and deductibles. The most popular Medigap plans are plans G and N. These plans will allow you to see any doctor anywhere in the country that accepts original Medicare without the need for referral. Premiums on Medicare supplement plans range between $80 to $150 or more per month, depending on the plan and the insurance company. When to enroll into a supplement plan? The best time to enroll into a Medicare supplement plan during your initial Medigap Open Enrollment Period. This is a 6-month period that starts the first of the month you turn 65 and enrolled into Medicare Part B and goes for 6 months. During this period, you can buy any Medigap plan sold in your state without any health questions and no medical underwriting. In addition, there are other times you can purchase a Medicare supplement plan without underwriting. These are called Special Enrollment Periods and include, but are not limited to, losing group coverage and moving out of your Medicare Advantage plan service area. So there you have it, a comprehensive overview of Medicare Parts A, B, C, and D. Understanding different parts is crucial to making the best choices for your Medicare coverage as you turn 65 or you're transitioning from employer coverage. If you enjoyed this video, be sure to click like and subscribe below so you can stay up to date with Medicare and all the changes going on. If you're looking to get more information on Medicare and compare plan options, you can give us a call at the number below or book an appointment with one of our agents in the description below. Thank you for watching, and we will see you on the next video.